Thank you, Joan.
Thank you.
Good morning, everybody. Before I get started, I want to thank Joan for giving us the opportunity to speak here. My name's Frank Pipitone. It's Italian. I'll speak a little Italian while I'm up here, so forgive me. Oh, it looks like the marketing guy gave me a promotion while we were here. I'm the COO of Solvonics Medical, and the reason why I'm here today is because a guy listened to his wife. And I know that sounds crazy, but I've been married for 20 years, and my wife would probably tell you that I could improve in that department. Now, how did that happen? Well, Solvonics was formed around a simple idea. One of the company's founders, Tom, his wife worked in a nursery and in a hospital. And shortly after she started working there as a layperson, she was astounded when she saw them trying to start an IV on an infant and using what amounted to a flashlight, shining it through the infant's limb to try to locate a vein. Now, for those of you that don't know, that's a pretty arduous process for the nurse or the nurse practitioner to do. And he got to thinking to himself, you know, is there a way that we can make this process a little bit easier? And Tom, being a good engineer, decided he was going to help his wife come up with an idea that will help improve this process and reduce some of the complications associated with vein start or IV starts or IV access. So our goal at Solvonics Medical really started off around one product, yet we've got two more products under development. I'm not going to talk about those today, but you know, recognizing that medicine, as in anything else, there's a process of evolution that goes along. It wasn't that long ago we were treating patients with leeches. Some cases they're doing it today. You know, but the process for delivery of health care improves over the years. And if there's opportunities to reduce risk, to make processes safer, to lower the cost, to make the healthcare experience better for the patient, why not capitalize on those? For people that need to have blood drawn on a regular basis, or if you've been involved in a trauma, or if you're going in for a simple surgery, one of the first things that happens is they start an IV. Often that process itself can color the whole experience at the provider's office, whether it is a surgery or whether it is a trauma. So we wanted to just simplify this. We wanted to make things easier. So the product that we developed is called the BloodHound. Catchy name, I know. We had a marketing guy from Procter & Gamble tell us you can't use the word blood in marketing. Every physician that we've talked to loves it. So that's the name of our product. 1.4 billion IV access procedures done in the U.S. annually. The challenge is those result in $350 million worth of treatment for complications from a bad stick. Some of the reasons for bad sticks are obvious, some not so obvious. So another story, we were on a plane one time with one of the company founders, and we were flying to Tokyo, and I had 14 hours to kill with this guy. And of course, we were colleagues at the time, and we started talking about a guy that worked in our office and how every month he had to go miss 4 hours of work because he had to have blood drawn. This guy was an oncology patient. He had very, very dark skin pigmentation, and the process took a long time. So offhandedly, I said, well, you know that vein illumination thing you were telling me about for the first 8 hours of the flight, maybe you could make something that would work for an adult patient as well. And so he did. It's a simple process, okay? It's not dissimilar to using a flashlight to locate a vein. The key for the Solvonics device is our intellectual property. It kind of identified what the opportunity was to improve upon the flashlight concept. All right? So we did a lot of studies, and we found that certain wavelengths of light penetrate and reflect through the skin better than others. And it's very simple. So one of our two patents is simply around the wavelength of light that we shoot into the skin. Our product is small. It's low cost. It's durable. I can carry it in my pocket. It's rechargeable. It holds a charge for 30 days. And it's easy to use. There's no reason not to get excited about this. Now, really, where do we see the biggest opportunity? Well, everybody loves babies, right? And we're currently doing a clinical study down at the University of Arizona Medical Center. And I'm happy to say, as of this week, we've just been accepted into a clinical study in Ormond Street Children's Hospital in London. As the results for those studies are coming to us, I figured, well, why not use some information that's already out there? So for the pediatric side, you've got 18 million venous access procedures done every year. Without any type of assistance or with no device being used, first attempt success rate less than half, 49.3%. With illumination, we see that number jump to 80.2%. More compelling, 52.8% done in less than 15 minutes without the illumination device. Afterwards, we're up near 87%. What does that do? Well, ultimately, it saves the medical facility some money because the people that are inserting IV needles into children can go on to do other things. And that is not tangible savings, but at the end of the year or the fiscal period, that money adds up. So it's not rocket science. You know, I grew up in a very loving Italian family, and whenever I did something stupid, my dad would look at me and go, "This one, not going to cure cancer." You know what? He was absolutely right. Okay? I might be able to help the guy that does cure the cancer. So when we came up with our pediatric device, we took a very simple product called a pediatric arm board. There's one in the picture there. Looks very similar to this, different color. We just said, you know what? Why not stick some light behind that? And our product was born. So, like I said, the science behind it is relatively simple when you think about it. And it's one of those moments where we thought, why hasn't anybody thought this before? Well, turns out people have. Okay? Honestly, the products don't work. And I've seen it firsthand. You know, our product works. It's as simple as that. You know, so over the past 6 months, I've become what I call a passionate advocate for the product. You know, the nice thing about the product is it's very simple. It's easy to use. We have one button on the product. And for anybody who's familiar with the corporate procurement process in a hospital or a healthcare institution, it's crazy. Okay? At $300 a piece, our device does not constitute capital equipment. In the clinical studies that we've done, our devices disappear. Other departments are stealing them because they want to use them. They wouldn't be doing that if it didn't work. Now, it's easy for me to sit back and listen to the 3 founders of the company talk about how exciting this device is because, you know, of course they're going to be passionate about it. I wouldn't want to be involved with a company that didn't have people with some passion behind the product. And they can tell me all day long that it works. So one of the exciting things that I get to do is I get to go out and talk to practitioners. I've been out in the field. I've talked to people that actually use the device. I've actually demonstrated the device to people. And the comments that I'm hearing back are amazing. You know, it works. It's not going to end up in a junk drawer. This is certainly better than the old way of doing things. We really need this. Why don't we have these in the field? And that's part of the excitement about the product is that we found additional applications. And one of the panelists mentioned talking with people outside of your industry. One of the people that we approached for a potential investment in the product was a veterinarian, past president of the American Veterinary Association. And he said, you know what? Veterinary medicine has been needing one of these devices for a long time now. We had no idea. You know, I was on the soccer field one morning, and I'm talking to one of the other parents, and I asked him to call me regarding something, and I gave him a card. A couple hours later, I get a call from the guy, and he said, "Did you know I'm an EMT?" And I said, "No, I didn't know that." And he said, "Well, I think that there would be a real good use for these in the field. I have a nephew who just graduated from the U.S. Army's medical school. He's a cardiologist, and he said, have you ever thought about using one of these things in the theater for people that are injured? there's another aha moment. We didn't think of that either. You know, the fact is, in the battlefield, when the soldier is wounded, if they can't find an IV or a vein, they use a process wherein they stick a needle right into the bone. And that causes a little bit of patient discomfort, but the obvious challenge there is it's not easy to put an IV in under clinical settings. Think about doing that in a helicopter or in an ambulance, in a Jeep, okay? There's practical application for this in more places than just the hospital or the doctor's office. So over the last 6 months, I've become what I call a passionate advocate for the device. I would invite you to check us out at the booth and let me make a passionate advocate out of all of you too, because we're excited. Thank you very much for your time.